This conference will now be recorded.
Hello, and welcome to a Healthcare Ready overview on chronic conditions and the COVID-19 response. So first, a little information on Healthcare Ready, why we exist, and how we were founded. So Healthcare Ready was founded in the wake of Hurricane Katrina as a response to some of the lessons learned during that crisis, where essentially members of the healthcare supply chain, the public health organizations, and emergency management agencies that respond to crises like these realized that more coordination was needed to ensure that the healthcare system could be more resilient against disasters, as they are, increasing in frequency, of course, and severity, and uh, now more so a normal part of our day-to-day lives is the risk of healthcare crises. And so Healthcare Ready was founded to be a trusted information sharing center and a partnership between the healthcare supply chain organizations across the board, from manufacturers to distributors to pharmacists and the end mile, as well as connecting with the public health agencies, the public health organizations, and the emergency management agencies that respond during disasters and have need to coordinate and communicate with each other. And so it was a response to the industry recognizing the challenges that exist there. And so we exist to essentially make their jobs a little bit easier, and find ways to share information better, partner better, and communicate better. So, of course, right now, as we are in a time of crisis dealing with the COVID-19 pandemic response, our job is just as important as it ever has been. And so we are working around the clock, and creating a lot of resources and a lot of information, sharing information across the board. And so essentially, this involves supporting the integrity of the supply chain, finding potential risk, acting upon those, and providing strategic input to the private sector that is able to respond to the call, and then providing that information to the public sector that is coordinating the response across the board. We have partnerships with healthcare systems, to identify the needs and the challenges, identifying critical lists of medications and supplies that are needed to treat COVID patients, as well as the potential shortages and disruptions that may exist for patients with other healthcare needs at this time. This, of course, has included global response, as this is not just a nationwide event, but is a pandemic, and many countries are impacted by this, and many countries that we work with closely to provide inputs to our supply chain are being impacted. And so it's really about identifying those risks as well, tracking that information, and determining how to best support the NGO and global response efforts, because this response is not just about protecting the US healthcare system, it's about really responding to the global needs that exist. And I want to make a direct point about the support to communities and patients that is, of course, critical now, where there are patients with overlapping needs, as we look at the healthcare response and look at the information that is needed for people to stay safe right now at a challenging time, not for the just for the healthcare system, but for the people living day-to-day lives and trying to stay safe and trying to navigate their own healthcare needs. And so some of the roles and resources that we create, essentially a lot of information sharing between the government and the private sector, a lot of information sharing between the emergency management agencies from the federal level down to state and local levels, to essentially identify what information is needed from the healthcare manufacturers, what information is needed from hospitals for the emergency management agencies to best do their job. And in that same respect, understanding the needs and level of support needed for the healthcare system that is responding to this crisis. What types of resources do they need in order to amp up production of critical supplies, in order to facilitate better deliveries of supplies to healthcare facilities, in order to direct the resources to places of greatest need? What information and support do they need from the federal government or the local governments in areas they're working? So information and coordination are really big parts of the work we do. And RX Open is actually a very important resource for folks across the healthcare system and stakeholders in a lot of different spaces, but essentially RxOpen is a map of pharmacy status that allows us to show the open and closed status of pharmacies in an area that has been impacted by a disaster. Generally speaking, this is activated for local responses, but of course now we are looking at a nationwide and a global pandemic. And so essentially, this is the first time we have activated RxOpen across the board for the entire nation. And so it's been an important resource, but essentially allows people from those supporting patients in a direct way to the pharmacists who want to make sure the information is correct in the system and show that they are open and are able to provide support. And then we also are now able to include dialysis facilities. So that information is available as well. And donation coordination, of course, is a very important part of the work we're doing because there are a lot of medications and supplies that exist out there that are in the supply chain that people are trying desperately to get to the places of greatest need. And so we're doing a lot of coordination to find the needs, match them with supplies that exist, match them with donations, PPE, hand sanitizer, medicines, and critical medical supplies that allow healthcare facilities to best do their job. And as well, a really important and added part of this response that we're seeing is not just healthcare facilities that are in need of critical supplies, but of course, the community organizations and community leaders that are doing work and not able to stay at home and do their job virtually, but for example, providing food distribution sites for people who are in need of access to healthy food in their neighborhood. It's important for us to be able to provide PPE and hand sanitizer and those kinds of personal protective equipment and sanitation supplies so that they're able to do their job as well. And so, of course, this response has been weeks and weeks of information sharing and support, and we have actually responded to about over 675 requests for information and assistance at this time. And these span a range of categories that include pharmacy requests, requests from pharmacists essentially trying to get their information updated on our system, on our RxOpen map, healthcare infrastructure requests, information, data analysis and research on the potential strains or upcoming and predicted strains to the healthcare system so the healthcare systems can be more proactive and anticipate those challenges. Dialysis facility concerns, and I'll talk a little bit more about that in upcoming slides. But essentially, a lot of transportation and coordination for patients to get to healthcare facilities if they're not able to access transportation in their normal routes as disruptions during disasters are anticipated. And right now, of course, we're seeing a lot of different disruptions that we have not dealt with before. Also want to take a moment to really acknowledge a lot of the partnerships that are created because essentially what we try to do is not reinvent the wheel and create new things that don't need to be created, but connect the organizations that are doing the work so that they can better do their job and better partner with those that can fill needs that they are looking for. So we're partnering with BIO to manage the supply donation coordination and offers of procurement, essentially connecting those who have supplies and are trying to get them to the areas of greatest need with those who are requesting supplies so they can know where to look for these things. We're also working with organizations like the Business Roundtable and Project Hope and other NGOs to coordinate donations of supplies to the regions as we coordinate with FEMA and are able to access information to best assess where these hotspot regions are, where they're budding, and where the resources are needed the most. And a few success stories of donations we have made to community hospitals, to the New York City Emergency Management Agency. Of course, we know New York has been a major hotspot during this disaster, so being able to make a donation coordination of surgical masks to the Emergency Management Agency was critical. And we've also highlighted here a couple of patient stories because, of course, the donation coordination and the partnerships and the healthcare infrastructure needs exist and are critical, but at the end of the day, these are all in place in order to allow us to best support patients. So patients really are at the root of the mission And so we also do respond to patient needs that aren't coming directly from a healthcare system, but may actually come from patients directly calling the hotline, directly reaching out to our support team. And so here are some examples that highlight the ways we're able to connect folks with resources to find their medications, refill them early, deal with disruptions to their normal treatment plans. And so that brings us to a little bit more information about the patient and community support work that we are able to do and have been doing during this COVID-19 response. So I want to highlight here that a major part of the focus that we have here on our community and patient work is understanding that there are people that exist with overlapping vulnerabilities, essentially making every part of their interaction with the healthcare system a little bit more challenging. And so we look at those with medical fragility often, those with chronic conditions that do not go away during disasters and therefore cannot forego any healthcare needs during disasters. And these can include groups with end-stage renal disease, those that are supported by the Kidney Community Emergency Response Program, as well as those with diabetes who need access to their insulin. And this is a group that is, again, supported by the Diabetes Disaster Response Coalition. And then that brings us to those with cancer who are supported by the Cancer Care Coalition. And the reason why we highlight these organizations is to say that there are groups out there that focus on specific patient groups. And so what we try to do is essentially coordinate across them and provide them with support to connect them with the federal partnerships that we may have, the research capacity that we may have, the direct patient connections that we make. Essentially, again, trying to make their job easier, and they support us in many ways. So it is not just a one-way street. They also are able to provide us with information to help us do our job better, so we can better understand the needs of kidney patients, for example, the needs of those with diabetes during disasters, so that the resources that we make are mindful of those different varying needs. And so that kind of covers the medical fragility that we see. Those with, again, chronic conditions that are not able to ignore their health when there are disruptions to the day-to-day schedule. And unfortunately, there are many people across the US that cannot just look at their health in isolation, but have a number of social vulnerabilities that make that all the more challenging. And essentially, what that looks like is whether it be financial access challenges, whether it be educational access challenges, lack of job security, lack of housing security, those who are homeless or in between different housing programs, those without access to healthy food, so they aren't able to always manage their health in the best way, but may have more access to fast food and corner stores versus healthy fresh vegetables that can help them regulate their health better. So with those vulnerabilities in mind, we recognize that people can't always pay attention to their health and need more information on the best ways to do this when they are navigating a range of needs that are all exacerbated during a disaster like this. And so some of the activities that we do to support people like this in these tricky situations, sharing the resources that can help them access their medication, that can help them find information on prescription assistance programs if they're having trouble paying for their medication, connecting them with resources like 211 that can also be a source of referrals to programs in their communities that are supporting them, because again, we're not fans of reinventing the wheel and creating new jobs. We are fans of creating partnerships and collaborations where they need to exist. So pointing people to the programs like 211 that can connect them with the organizations that are already doing amazing work in their community, but may just not be they may not be aware of that. We've also created new resources where they need to be created, including Map Your Meds, which is a map that we've stood up that essentially points people to all of the emergency refill and medication information that exists in their state. So they're able to just quickly plug in, look at their state, find out what resources exist, find the programs that are, allowing them to get early medication refills, or, insurance support for paying for medication. Essentially all the resources that exist at the state level, so they don't have to navigate different websites that they may not be familiar with, and it's all in one place. And of course, our support for patients cannot stop at creating resources and sharing information and understanding that understanding the needs that exist, but it also has to actually get to the community, of course. And so this is why we directly work with the community organizations, the advocacy organizations, the community-based groups, the churches, the NGOs, the leaders, the advocates, the activists, the people that are working on the community level and are going door to door, hopefully with their mask on, but are essentially the trusted speakers in the community that are actually able to share the information, because they may not know healthcare ready and they may not know why they need to listen to us. And that's not, necessarily a bad thing, but it is about being able to get that information to them. And so we have our healthcareready.org/COVID-19 page that allows people to access the different information that we have. So moving forward in the COVID-19 response, there's a few areas of focus for us, and it spans a range of needs and priorities that we've identified in the work we've done, and that continue to be areas of focus and areas of need as we look at the upcoming months of this response. So of course, like we highlighted earlier, there are communities that are facing more disparate impacts because of this response. The Black and Latinx communities have dealt with a higher rate of severe illness and worse outcomes due to COVID-19 because, again, there are overlapping needs that we've identified, whether it be higher rates of chronic conditions like diabetes and asthma and hypertension that make it harder for people to recover from COVID. But then we cannot ignore the structural challenges that exist in these communities that put people in higher and greater risk of actually contracting the virus. If they're not able to if they're not able to stay at home and have teleworking capabilities, they're more at risk for still being in an office, still being in a workplace where they're being exposed to a lot of people. If they don't have the supplies or the financial situation, the financial security to really tend to their health, that can make them, that could be a priority that is on the back burner. So we really know that in these communities of color, it's not something we can ignore. And so we continue to focus and support on how we can actually support these communities, not just identify the needs. And really often it is about extending partnerships beyond silos. Of course, there are organizations that are already doing great work in these communities. So it's about making sure that they have information on the healthcare system and the challenges that exist at a disaster level if they have never had to deal with that at the level that we are all dealing with it right now. And there is always a need for enhanced coordination. That's kind of the pinnacle of emergency management, is coordination and communication. And so essentially we're still focused on the supply chain in a lot of ways, and supporting coalitions and making sure that the challenges that are facing pharmaceutical companies and being able to provide supplies and amp up production where appropriate, and make deliveries if they're a distribution organization. We're continuing to provide the information, the analysis, and the administrative and logistic support that allows these groups to do their job. And cross-sector coordination does not go away as well, because while we have the supply chain that exists and can respond to disasters, there's information that is needed to be transferred to the federal government, the local governments, the state governments, to actually understand what the healthcare system is facing and how they need to support with updated policies, updated strategies to facilitate these responses and these activities to disruptions. And of course, we are really looking at the long term here. This has not been a short response, and it's not going away anytime soon. We've been activated for weeks, months at this point, and we will be activated and working indefinitely until the healthcare system is at a different place than it is right now. And so we're still responding to these strains and recognizing that there are new challenges that are coming up as we move forward. And this includes, of course, the hurricane season that's upcoming, and looking months in advance to flu season, and how the overlapping disasters will present challenges that are unique, and we essentially cannot ignore them. Same thing with reopening, and the fact that many states at the point we are recording this are now reopening economies, opening up stores, and relaxing some of the stay-at-home orders and social distancing measures for economic reasons. But that of course means that there needs to be an extra vigilant public health response as we look at potential spikes in cases and potential need for increased resources and supplies to allow people to actually navigate these reopenings without running the risk of creating new hotspots and creating new spikes in cases. And so, of course, some of the resources and technical assistance that we have provided so far is highlighted here. So we have tip sheets for a range of disaster types that we respond to often. Of course, we have a pandemics and disease outbreaks tip sheets that essentially allows a patient to, take a step back, grab an outline of the steps they can take when they're going into a disaster, if it's during a time of calm. But of course, now we are already in a pandemic. So it is really about looking at what we can do right now to stay safe. And breaking some of that down. Some of the standard precautions like hygiene, safe hand washing, wearing masks where appropriate. These are the tips that we include in this, so patients can kind of get a very simple how-to on how to protect their health during disasters. And some of the considerations that exist for the health chronic condition patient groups that we look at, like the diabetes patients, the dialysis patients, and related groups. So thank you for listening to this presentation, and I hope you learned a little bit more about the work we're doing and how we can support patients with chronic conditions during this disaster. You can visit www.healthcareready.org for more information. For any response-related questions or needs for assistance, you can contact alerts@healthcareready.org. Any general information about Healthcare Ready can be found if you reach out to contact us at healthcareready.org. Our hotline is 1-866-247-2694. We have our COVID-19 emergency response page, which outlines all the resources that I've gone through here. And you can go visit healthcareready.org/COVID-19 for more information. I would also suggest signing up for our situation report so you can track the work we're doing and the issues that we are tracking. And you can do this by visiting healthcareready.org/contact-us. Finally, we are active on social media, and we are on Twitter at HC_ready and Facebook as Healthcare Ready, Facebook and LinkedIn. So you can follow those for updates on the resources we're making that are a little bit more ad hoc and day-to-day than our situation reports. So thank you again, and I hope this has been a beneficial presentation. Thank you.